Dear Dan Academy listeners, hello everyone. I hope you're doing well in this new normal time. Thank you for inviting and having me here today. My name is Nana Bit-Avragim. I'm a doctorpreneur and ecosystem builder. Over the past 7 or 8 years, I've been working as a business and venture architect in the field of digital health, building and strategizing new concepts, hubs, and companies. I actually like working on solving systems challenges, and I'm passionate about emerging technologies and Internet of Medical Things. Experiencing pandemic like the current one has exposed many gaps in our global healthcare system that wouldn't have been prioritized otherwise. However, every cloud has a silver lining. That is why we actually see and experience now and everywhere, and despite or even due to the COVID-19 crisis, the rise of new partnerships, new models of collaborations, accelerating adoption of digital technologies, and booming interest in holistic well-being. But what does that actually mean? Today I would love to introduce you, dear listeners, to a less popular topic of retail health, and we'll try to showcase a few successful stories implemented in the United States, Canada, and Europe. So it's about time to evolve the full potentials of retail health and build new healthcare experience. And I would like to underline this word, experience, in Europe. So let's talk more about retail health. What does it actually mean? First of all, retail health is a great and current example of cross-industrial and outcomes-driven business model in digital health. This is a quiet in-person approach by integrating primary care into retail and making it user-friendly and centric. Retail health are clinics and health centers or hubs and pharmacies located within the retail stores. Traditionally, those health clinics were not designed to address pressing or big issues, but instead smaller health needs that can be handled at the patient's or person's convenience, let's say to measure blood sugar, blood pressure, meet nutritionists, or to get a dental care. We basically all expect convenience, quality, and transparency when we choose how to spend time and money, right? This is what citizens are increasingly seeking from healthcare providers. Consumers have been clear in what they are looking for: convenience and flexibility. And so healthcare providers can offer this by designing that are both locally relevant and tailored to specific needs. Nowadays, the modern stores play a much different role for brands. The stores create the customer experience. You know that. And retailers know that location, communication, education, hospitality, convenience, and in-store technology are all critical components of connecting with the people they hope to attract. The best example everybody knows, Apple stores. I think retail health addresses in the first line easy access to basic healthcare services and preventive community care located in the place where people live. This is, on my view, an emergent care model to millions of consumers, as well as the huge experiment and a fantastic experiment for healthcare systems to consider when providing services to new and existing patient populations. I mean the generations Z and millennials. But let's check it more precisely, and here are some examples from the US and Canada. Okay, US and Canada. So the concept of retail was born and started and mostly currently developed in US and Canada. It started in early 2000 and currently it's well developed and expanded. In US, many clinics are nested within the major retail such as Walmart or CVS pharmacies, offering basic primary health care like walk-in extended operational hours, In Canada, retailers such as Loblaws or Rexall pharmacies are venturing into the retail clinic spaces. Walgreens is another front runner, combining in-person and digital engagement to stay connected with its customers. So here, convenience is a huge factor. You know, 1/3 of Americans live within the 3 miles of any Walgreens stores. At the store, people can talk with the nurse practitioner as well as the pharmacies. They can take everyday health needs, they can get shirts or health screens, and so basically access to a physician over the teleconsultations. Yesterday, on July 9th, Walgreens has announced that they will open primary care offices in up to the 700 drugstores in the next 5 years, partnering with VillageMD. VillageMD is one of the biggest primary care provider in the US. More than the half of the clinics, this is really important, will be opened in the areas with a shortage of health professionals and in underserved populations. So Walmart is another big retail in the US and Canada, and Walmart has opened 4 primary care clinics called Walmart Health. Furthermore, Walmart unveils a plan to build healthcare workforce 2020. Imagine, healthcare workforce 2020. Like in an Apple store, rather than focusing on transactions, healthcare design can foster conversation, learning, and building community. So fascinating, really fascinating that such a retail Walmart will start to retrain employees into starting level medical and pharmacy professionals just for $1 per day. I think this is a well-needed and well-prepared structured concept. Amazon acquisitions of online pharmacy PillPack basically underlined its broader healthcare ambitions. And furthermore, CVS Health, which acquired health insurer Aetna, plans to open 1,500 health hubs stores by the end of the next year, 2021. The redesigned stores have a variety of health-related features such as clinics, wellness rooms, and more other medical-related products. And of course, a lot of options for telehealth. So healthcare can learn a lot and basically take a lot of valuable lessons from retail examples. Engaging people here means connecting with them where they live. And this is basically a place away from the hospital or outside of any acute care settings. And I think that to maintain better health, people want easy access to very basic healthcare services, but increasingly they also want to maintain their health while they are still well and healthy, not only when responding to a health emergency. To incorporate wellness into their daily lives, consumers definitely need access to on-demand information, extended hours, convenient locations, walk-in appointments, affordable services. That is why CVS hired a Fitbit executive to lead its consumer health efforts. Is it not smart? I think it's absolutely amazing. So how about insurance companies and payers? Healthcare insurance carriers like Horizon Blue Cross and Blue Shield are also embracing a retail model to help their customers understand their coverage and educate themselves on wellness. MyQuest. Let me give you an example with MyQuest. It's a Quest diagnostic app. It's a lab provider which gives 24/7 access to lab results. And recently and currently during the corona crisis, MyQuest basically are offering a lot of testing in the US. The availability of data-driven healthcare with network providers will change, obviously, the global healthcare landscape. So at the end, to summarize a lot of that examples and basically all experience what we collected to current days, I'm quite positive, and I would like to underline that in Europe, we would need to create the need for more integrated systems that bridge existing silos to, silos of acute, long-term primary and community care, as well as wellness and data-driven tools with preventive programs. And that probably the way how to develop retail health and retail medicine in Europe. We need more such an integrated health concept of care providers, convenient and safe wellness spaces, combined with education and building community in Europe. So I wish that in the next years, the biggest and the largest European providers like Aldi, Migros, and other will learn and try and experiment with retail health. Well, how do we tackle the future now? I remember a quite popular catchphrase of design thinkers: the future is now. Actually, today this is the reality. And if yesterday's recipe to win was all about disruption, today's laws is adaptability, and how essential and powerful is this in almost everything what is happening around us. The COVID-19 crisis has led us to redefine the concept of wellness and re-examine the importance of resilience. Yeah, this is another new catchword for now. Resilience you will hear 100 tons of times and see all over the current situation. But the uncertainty suggests the presence of surprise. Yes, surprise is by definition unexpected. And in German language, it has a kind of a negative meaning. But in order to create, we must look for unexpected things to be surprised. I think the next big thing may change everything, and it might be a wild card. So I would say we need to think big but local.